Well, welcome back, everyone. Today we're exploring a leading edge solution for issues with spinal discs. So now available at Lima Memorial, and it's called Prodisc, Total Disc Replacement. So joining us is Dr. Jeffrey Lobel. He's a nationally recognized expert in advanced spine care and the medical director of neurosurgery at Lima Memorial. So Dr. Lobel, I really thank you for being here.
Well, thanks for having me. I really appreciate it.
Yeah, so can you share with us the total disc the total disc replacement is, and how does it differ from the more traditional options for issues with discs?
That's a great question in terms of how does it differ from standard fusions and standard techniques we use for surgery. A disc replacement, if you think of a hip replacement or a knee replacement, follows a very similar philosophy where the device is designed to preserve motion and also preserve or reduce adjacent segment degeneration. What I mean by that is if you have a fusion at one level, the level above or below can be directly impacted. So if you put in an artificial disc, the idea is to preserve motion and thereby reduce how much you might have degeneration at the level above or below where you had your original surgery, and thereby try to reduce the likelihood of needing future surgery.
All right, so who would be a good candidate for this type of surgery?
Everybody's different in terms of who's a good candidate. We really have to assess, look at some of the motion people have in their neck with x-rays, look at the degeneration that we see with either a CT or an MRI scan, and actually speak with the patient in terms of what their goals are. Not everybody qualifies for an artificial disc. It's very individual dependent. And ultimately, it's a way to provide people with an outcome that they really would like to achieve. But we have to be very mindful of the fact that every surgery for every individual can be very different.
Right, so what are the advantages of this procedure when it comes to movement and also recovery time?
Recovery time for a lot of the patients that I work on can be anywhere between 1 to 6 weeks. Time in the hospital varies individual to individual. Frequently, we have people leave the same day after their surgery. And on some rarer occasions, they can stay overnight in the hospital to recover. But the ultimate idea is to return to work or normal activity as soon as somebody can. To achieve those goals, it depends on that individual, their activity levels, and what they hope to ultimately accomplish and what they like to do in life routinely.
Okay, so what do we know about this procedure? It's safety and also long-term success.
There's been a lot of studies on various artificial discs that people have inserted into either your neck or your lumbar spine. The success has been quite high, and therefore they're FDA-approved procedures, which are done routinely and safely. The surgery for a standard neck fusion is almost identical to that of the artificial disc. So when it comes to safety, patients don't need to wonder whether or not an artificial disc will have new or different complications as compared to a standard fusion.
All right, so for someone that's watching right now who might be interested, what's the first step? What should they expect if they come in for a consultation?
Oftentimes, patients have reached an endpoint where they feel that every conservative treatment modality doesn't work. For instance, physical therapy, injections, on occasion, various pain medications, and chiropractic care are modalities that I have lots of patients either already go through or are willing to sometimes endure, especially if they have a lot of neck pain. But to qualify for surgery and determine whether or not you're a good candidate for the disc, again, as I'd mentioned previously, is very individual dependent and will be made after discussions and, of course, insurance. The insurance companies have to decide ultimately whether or not we can do the disc because they sometimes have some hesitations. So you need to be mindful of what your insurance companies allow and what they expect of you before you have surgery, because the decision isn't always 100% ours.
Right, and if anybody has any questions or might want to make an appointment, you can always call Lima Memorial Spine Neurosurgery and Pain Management at 419-998-8234. So, doctor, thanks so much for joining us today. Appreciate it.
Thank you. Have a wonderful day.
All right, well, don't go away because we have more when we return.